Amazing, lovely. So this is an official welcome to everyone. Those of you on YouTube, lovely people on TikTok. It is still Josephine Greatness on your midwife page, and then Josephine Greatness on Josephine Greatness TV on YouTube. Welcome to today's live health session. On TikTok, this live session is dubbed the Your Midwife series. So I've been here on a live session to discuss blood groups and rhesus factors, sickle cell, blood genotype, in quote sickle cell, and how it affects, choosing a life partner. I've also been here to talk about what else did we talk about? The last one we spoke about was what determines the gender of your baby. And today we are here to talk about a very important topic that sometimes is not discussed openly. And the topic is ectopic pregnancy. This condition can affect women at different stages of their reproductive life, and raising awareness of this topic is key to saving lives. So I'm honored to be joined by Ms. Shomi, a dedicated midwife with lots of years of experience or expertise in maternal health. She supported many women through pregnancy and throughout their reproductive challenges. She'll be helping us break down what ectopic pregnancy really is, the warning signs to look out for, treatment options, and how women and families can find support. We will also be taking your questions on this live session. So please feel free to drop your questions in the comment section. You can also request to join the guest seat so that we can talk about whatever is bothering your mind concerning this valuable discussion. So let's get started. I'm going to invite Nes Shomi onto the guest seat. And as said, as we do that, guys, please, if you are here with us on TikTok, please keep liking. On YouTube, please keep liking the live session, as this helps to notify people that we have started a health education session this evening. It is currently 3 minutes past 5 p.m. in UK. Pop in the comment section. Let's know where you are joining in from. Next, show me. Thank you so much.
Good evening. How you doing?
I'm good, thank you. How about you?
I'm very well. Well done.
Thank you. Thank you. I really appreciate you making time to, join me here today. God bless you.
You're welcome. To everyone.
Yeah, great. So, let's show me. Kindly give a brief introduction of who you are. I've said something about you already. Let the community members, let our people hear from you, the host's own voice.
Hello, everyone. My name is Mary Shomi, popularly known as the Shomi. I'm a registered midwife. I work in the UK, trained in Nigeria, with several years of experience. But my passion is about educating women and making sure they have information and knowledge about pregnancy, because this is going to just enhance them to make informed decision about their health. So I'm also the founder of ANC Women Show Me, which is what we do, where we empower women with knowledge, on using telemedicine. Now we are focused on WhatsApp. We use WhatsApp, and we share information with pregnant women and support them throughout their pregnancy. So I would say that's what I do. Basically, I love women.
You are doing a great work here, Show Me. So, guys, the replay of this live session is going to be available on YouTube. So, right after this live session, please head onto YouTube. Check the description section of this live session. I'm going to add Neshomi's YouTube channel. Neshomi, are you comfortable we add your WhatsApp page details into the description section so people can join in?
So we have a membership form.
Okay.
If people want to join, they have to go through the membership form so that they know who we are. If they want to join, then they can join from there.
Great. So we can add that to the description section of the replay.
Yes, of course.
Amazing. Great. Guys, please stay tuned. Today we are talking about ectopic pregnancy, and we've got the lovely, experienced midwife in the person of Neshomi, who is going to help break down the topic. So, without wasting my time, Neshomi, can you please tell us what ectopic pregnancy is in simple terms?
Okay. So before I start with ectopic pregnancy, I just want to explain very briefly what the normal pregnancy process is. Because for you to understand what ectopic pregnancy is, then you need to understand what the normal process is. So I don't know if we know what the uterus looks like. I've added a little drawing. I don't know if anyone can see it.
Yeah.
So usually, as a woman, you have fallopian tubes. You have your womb. Then you have it protruding inside of you. It's staying inside your pelvic. So it's inside your pelvic. It is the cervix that protrudes to your vagina, and the fallopian tubes are holding your eggs. So usually every month, during your ovulation period, the egg is released from your ovum, and it goes through the fallopian tube. If it meets with a sperm, it is fertilized in the fallopian tube. Then it travels down to the womb area where it is implanted, and that's how pregnancy occurs.
Wonderful.
But with ectopic pregnancy is any pregnancy that does not implant in the original place that it is intended for. That it is not implanting in the womb, it's implanting anywhere else apart from the womb. The most common place that ectopic pregnancy implants in is the fallopian tubes. So usually when we say ectopic pregnancy, most people will talk about the fallopian tube, but it can occur anywhere. It can occur at the cervix. It can occur inside the abdomen. So I would just say it's just any pregnancy that does not grow in the womb. It's an ectopic pregnancy. So we would look mostly because of the most common one, which is the one that occurs in the fallopian tube. So I'll be making reference to that one a lot because that's what many people would have heard of, maybe would have experienced or would have seen someone who has experienced it. So
amazing. Thank you very much. So how common is ectopic pregnancy and who is most at risk?
So can I hear your first statement again, please?
How common is ectopic pregnancy?
Yeah.
And then so, who is most at risk of it?
Looking at the numbers, I believe that ectopic pregnancy is not as reported in African countries as it is here in the UK. In the UK, we have about 11,000 ectopic pregnancies per year, which is a lot. That's about if you have 90 pregnant women or 90 people who are going to get pregnant, at least one of them would end up in an ectopic pregnancy or would have an ectopic pregnancy. But this is very common because with the work I do, I'm a little bit privileged to see the reporting of ectopic pregnancies that happen in my trust. So it's when you see these ectopic pregnancies coming in, it's a very delicate diagnosis or a delicate condition that if it is not looked after properly, you will bleed so much or you can even lose your life. So the people that are mostly affected, usually, it depends on your lifestyle. Smokers are mostly at risk. People who have recurrent sexually transmitted infection, so people who have pelvic inflammatory disease, because of, when you have those infection and you have those inflammation, sometimes they scar your organs. So, and it's just like a third road. When the road has a lot of potholes, someone that is moving in there would just go up and down, and that's what happens to the egg when you have infection and your pathways, like your organs are scarred. Then when the egg is coming, it's most likely to be stuck at some point, and that would increase your chance of ectopic pregnancy. Also, for people who have had IVF pregnancies, it's also a risk. It's also a risk. We don't know why. And also, women who are above 35, from the information that we have, we don't know the exact reason why they are more at risk. But from the information we have, when we see this presentation of ectopic pregnancies, is usually higher in the number of people in women that are above 35 years. So when it's occurring, it's mostly occurring around people of those age. Also, people who have intrauterine device, the IUD, that's one of the side effects of it. Because you have the intrauterine device in your womb to avoid pregnancy. So if the sperm finds its way into the fallopian tube, it then cannot come out to the uterus because that entire device is blocking the womb. So you also would be at risk of ectopic pregnancy. So those and people who have had maybe previous, for example, if you have ectopic pregnancy once, you're most likely you can have ectopic pregnancy again because definitely the impact has already happened to your egg. So if there's any fertilization, it can also occur. Or it's just it's different risks, and sometimes it happens without any previous risk. To be honest, you don't even know why it happens. It just happens. So, but those are the risks that that research has shown that will put you more at risk, or you likely be at risk of getting ectopic pregnancy.
Ectopic pregnancy is a gynecological emergency, as you've mentioned, and it's got a lot of obstetric implications. And so I would say it's a life-threatening condition. So it's very important that people get to know the early signs of it so that they can act quickly to one, save their lives. That's the biggest, outcome of what we are expecting. If you are able to find out the signs and symptoms, the early signs quickly, then we can salvage the situation. So can we talk about let me not use the word some, the early warning signs women should look out for? Not only women, but anybody at all. Because there are instances where the woman herself may not realize that this could be an early sign of ectopic pregnancy, but the man or the friend or the colleague, whoever is around the person, don't you think you should see your doctor? Because this looks like something I've learned about, I've read about, I've heard. So what are the early signs of ectopic pregnancy?
Before I go into the early signs, I would say it's very important as a woman in your reproductive age to have knowledge of these things so that you can then advocate for yourself. We have women who come to the emergency department with some of these signs and symptoms, but because they have no previous knowledge, they can't even maybe prompt the doctors. Because fine, the doctors have a lot of knowledge, but sometimes if you don't prompt them, they might not even remember at that time. And this is something between life and death, to be honest. So it's something you're not thinking about. So the first thing I would say is, if you are a woman in your reproductive age, if you have any severe pain, the first thing you should do is a pregnancy test, to be honest. If you are sexually active, that's the first thing you should do. Because when an ectopic pregnancy, you would have a positive pregnancy test. So if you then know that you are pregnant, then you can then now think that why am I then having this pain? Because if then you are not pregnant, then it could be other things. So the first thing for you to know is that you should try as much as possible when you go to the hospital. That's why when you go to the hospital and they ask you have to do pregnancy tests, you are squeezing your face. Why do I need to waste money? I'm not pregnant and all of that. No, it's not like that.
We want to rule out.
It's because they want to be sure of how to support you. So just make sure you have that in your mind, that when you are sexually active, if you have any severe abdominal pain, you should think of pregnancy. And you need to do a pregnancy test. You can do the urine pregnancy test. It's very simple. It's very easy. And for women who would, if you're feeling fainty, you're feeling dizzy, you're not just feeling all right, because it might be a sign that you're bleeding internally and you don't even know. Yes. And also you can even have shoulder tip pain. There's something also very common with them is vomiting. Vomiting also is really common. And when these women come to the hospital and they have positive test results and they are vomiting, sometimes people's mind would go to maybe hyperemesis, gravidarum, or morning sickness. Sometimes it's not really quick to think of, could it be ectopic pregnancy? There's this work we're working on in my choices. Think Ectopic is in the
Think Ectopic.
That's a great
so
when
a great
a woman comes
thing.
with positive pregnancy test and she's having abdominal pain, she's bleeding, whether slightly, because it's usually slightly because it's internal bleeding. Whether she's bleeding slightly or she's having spotting and then she's vomiting, she's tender in her abdomen. When they touch you, you're really tender to touch. All those signs, those are the classic signs of ectopic pregnancies. So if you're saying that, Or if you're at home and you think I'm unwell, I'm feeling dizzy, I'm feeling very unwell, please go to the hospital. I know there was a case that I saw that the lady was quite feeling unwell, but because she has been to the hospital before, they sent her back home. She didn't want to go again until she collapsed, to be honest. So please, if you go to the hospital, you can also act as your own advocate to say that, oh, are you thinking it might be this?
Yeah.
Can I do a scan to see if it is this? You understand? Just advocate for yourself.
Yeah.
So those are one of the signs and symptoms of ectopic pregnancy.
Yeah.
And in most cases, if once it's ruptured, you collapse. Usually that's really easy
because you are bleeding internally.
Internal abdomen. So usually they will just collapse almost immediately.
Yeah. And you know, I've had a personal experience. Somebody very close to me had an ectopic. I wasn't yet a midwife. I was still in school. I was a student midwife. And since then, I've become so I love what your trust is doing. Think ectopic. I've become very think ectopic. So in my midwifery practice, I once came across, I was taking care of a patient who had, the signs my friend, my very close person had. And so when I took over the shifts, I was like, no, after assessing her and examining her per-abdominally, I just knew this was ectopic. So I just told whoever was leading the shift that I think this is an ectopic. And they were like, "You've not taken a scan. How do you know?" I'm like, "No. With all that I've felt, my palpations, and I think it was ectopic." Do you get it? And managing it, finding out it was ectopic at that stage was life-saving for that lady. And that is one of the main reasons why I chose this topic in the early stages of the Your Midwife series, because it's finding out, assessing and identifying that it's ectopic pregnancy is very, very necessary in the prognosis or saving the patient's life. So what factors increases the risk of ectopic? You've mentioned the risk factors, but what other factors increases a person? Because somebody may be a smoker, somebody may be but the person is a smoker but has never had ectopic pregnancy before. Somebody else may fall into the categories of 3 or more of these risk factors. Does it increase? Do you get what I mean? I want to put my question across properly. So with somebody with 2 of the risk factors and then another person with just 1 risk factor, how great is the chance of these 2 people, being prone to this condition?
Yeah, like we know, the more risk factors you have, the highest the risk of you having ectopic pregnancy. But this is not to say that if you have one of the risk, you can't still, have ectopic pregnancy. Like I said, we are not working. It's not something you can predict.
It's true.
And it's not something you can stop by yourself.
Yeah.
So you cannot say, "Oh, I don't want to have an ectopic pregnancy." It's not possible. It happens, and it is when it happens that it's the data that we get from the ones that have happened is what we're using to project that. In the people that have had ectopic pregnancy, when we count 100 women who have had ectopic pregnancies, these factors are higher in those women. So that doesn't mean that someone would come in, some people would, first pregnancy and it's ectopic pregnancy.
Yeah.
So you might not even know the factors. You might not even fall under any category. But as far as you're a woman, you should be thinking ectopic pregnancy. Not like, I'm not saying that you should be scared, to be honest. Like when you start to feel unwell and you have all these signs that we've talked about, you think ectopic pregnancy.
Think about that.
Because sometimes you might have not even had anything to do with your fallopian tube. Anything at all. You just fall pregnant, you're unwell, you go to the hospital, or you even randomly just scan. In places like in Nigeria, where I'm from, where people have easy access to scan, as soon as they know they're pregnant, they go.
Yeah, they just walk into a sonography.
Most of the times they will just no other factors. They just like, we think we can't find the pregnancy in the womb. Where can it be?
Where is it?
We then start looking for the pregnancy and then you find out that the pregnancy is actually in the fallopian tube. So we have the risk factors. It's the same as I've mentioned. Those people who are doing fertility treatment, if you're older than 35, if you're smoking, if you have recurrent sexually transmitted infection or untreated sexually transmitted infection, pelvic inflammatory diseases, these are the things that can increase your chance. And even having IVF. Yes, people that are having IVF are also at risk because then you're implanting. Sometimes you implant not just one egg, so you implant more than one. So sometimes it can find its way, away from the original place that we are intending. So those are still the risk factors that I would still highlight to women.
Okay. So how is this condition diagnosed?
Yes, so to be honest, it's mostly based on your symptoms.
Okay.
Because that's the earliest sign of diagnosing ectopic pregnancy. Is mostly based on your symptoms. But usually you can diagnose it from a scan. You can use the pelvic the palpation.
Yeah.
Like you said, when you palpate, when you do pelvic palpation, when you palpate you can just feel that tenderness. It's just like midwives, when someone is having an abruptio, like if the placenta is separating, and when you touch the abdomen, you can just know that something is wrong.
Yeah.
So usually when you touch the abdomen, you can just know that something is wrong. But then you can confirm by using the scan. So the scan is what is going to confirm it. Okay, I'm just waiting for Josephine to be back.
I'm back.
Okay, welcome.
Sorry.
So the scan is going to confirm it, and also in the presence of a positive pregnancy test. So to confirm it, with your symptoms, they do pregnancy test for you. If it's positive, they check your pelvic. If you're having tenderness in your abdomen, they do a scan, and that's how we think of ectopic. Or in other ways, if anything happens, like in the event of collapse, sometimes they just take you to the theater and do a laparoscopic surgery for you, and that's where they will find out that it's actually an ectopic pregnancy.
And that's the next question I'm going to ask. What treatment options are available?
Okay, so we have. Oh, thank you so much. I'm receiving donuts.
Yeah.
Thank you.
And roses.
Yeah, we have. You can use drugs.
Yeah.
I don't want to mention the drugs, but you can use drugs. There's some drugs, if it's diagnosed early, they can give you the drug to actually stop the growth of that egg, or even destroy the cells of those eggs. Wonderful. So that it can then come down.
Great.
Yes. So if it is diagnosed early enough, like if you are very lucky, oh, thank you, Black Players Glory. If you're very lucky and you find about it early, they can give you that drug to stop it.
Wonderful.
Because that's a better option than having to do surgery. So the surgery is the next thing. Usually they always have to do surgery to cut open your fallopian tubes and then remove the eggs from it. Usually it's always a life-saving procedure. So don't think about, then I'm not going to have my fallopian tube.
I'm not going.
See, it's better for you to not have fallopian tube than for you to even
not have your life.
Be dead. So yeah, that's one thing. So if you are diagnosed of ectopic pregnancy, don't think too much. Just take action quickly.
You need to save your life.
Maybe for people who have been waiting for pregnancies and they get pregnant and they're like, hey, I believe God can do it. Yeah, I believe God can change it, but this is a life-threatening situation. Yeah. You need to get your options and your facts very right. You understand? So those are the treatments, to be honest, that happens with ectopic pregnancy.
Yeah, and I'll say that if you found out that your pregnancy is ectopic, and as Ness Shomi said, God can do it, I will advocate and say that knowing the diagnosis is God, because there are people who may never know that an ectopic pregnancy was growing until they are no more, and then later postmortem or laparoscopy, we'll find out that it was ectopic. So you knowing that it's ectopic is a miracle. It is God. And so that is the first step to going through your treatment and management to save your life, and then save yourself and your family a lot of sorrows. So What happens if ectopic pregnancy is not treated early? Because there are people who delay, as you said, there are people who have looked forward to a pregnancy and they find out they are pregnant. They are hearing us today, oh, ectopic, if I go, they are going to take out the pregnancy. I don't want to do it. What happens?
The highest risk for you is the eggs. So now, the egg is supposed to grow. The fertilized egg is supposed to grow. And if it's inside your womb, usually it will grow. That's why you see pregnant women's belly, protruding.
Yeah.
So when the egg starts to grow, it will grow to an extent because the fallopian tube is really small. The fallopian tube cannot accommodate the pregnancy anymore. Yeah. So once it grows, it just bursts open. And once it bursts open, blood from those places, and it's an internal organ.
Yes.
It's very vascular. Like you get blood into your uterus very, very well. So once it bursts open, you will start bleeding internally. And once you start bleeding internally, it can lead to collapse and it can lead to death.
Yeah.
That's the highest. Yeah, unfortunately.
So that there is nothing like, oh, it's ectopic, but then it degenerated and I'm fine.
Rare cases. Yeah. Extremely rare. I don't think I've
not heard of it before.
I don't think I've heard of it. Or maybe they used the injection, the medication, and then it stopped growing.
And that's definitely when it is diagnosed in the very early stages.
Yes. Yeah. But otherwise, it's even when doctors hear ectopic, like
the way you run
around, trying to salvage the situation because you lose so much blood.
Yeah.
I see people lose up to 3.6 liters. Someone lost 4
liters. More than 4 liters.
You lose so many blood, so much blood very quickly.
Yeah.
And in the advanced country, you get, you have all the anesthetists, you have the blood bank ready to do it. But one of in countries
most
where
African countries
they're not as advanced, God forbid, you just usually death is always like very imminent, to be honest. So we need to be very careful.
It is an emergency. It's a serious emergency.
We need to be very quick and make that decision about your health and give yourself that power to make that decision. Don't let anyone else make the decision for you, because if anything happens to you, it is your life.
It is your life.
It is your dreams that will be cut off. Yeah. So you need to take that action very quickly.
So what emotional challenges do women face after an ectopic pregnancy?
Yeah, it's really difficult. It's really difficult because for some people, they might not even know that they were pregnant.
Yeah.
For some people, they've been expecting the pregnancy. Like we said, IVF treatment is one of the risks. So imagine you paying millions of naira trying to do an IVF, and then it ends up in an ectopic pregnancy. You grieve.
Yeah.
You feel that loss. It's a loss, and you need support for it. So you will feel that mental burnout. You feel the pressure. And for example, if you think, oh, this baby could have lived, and then it happened to be an ectopic pregnancy, you just keep thinking about it. So you need support for that. And also, sometimes it's a very traumatic incident. Like everything happens so quickly. You see your life going out of you. Collapsing, rushing to the theater, doing surgery for
running
you,
around,
out of surgery. Sometimes it's really traumatic. So you need to give yourself grace. You need to understand. You need to speak to experts. You can speak to us. You can speak to midwives. You can speak to doctors. Who can explain this situation for you. And don't blame yourself, because you actually cannot cause it. It just happens. So you can't blame yourself. You can't prevent yourself. So be gentle on yourself and speak up. Speak up and get support. Because some people feel, oh, because it was just 8 weeks, and why are you crying? Is it not just 6 weeks? No, even if it was one day that you knew that you were pregnant and it comes off, the emotional attachment that you would just have, it's one of those things. So, and also people would be scared. Like we said, having an ectopic pregnancy puts you at risk of in future pregnancy. Do you understand? So when you've had the ectopic pregnancy, you might be scared of even getting pregnant. You might be scared of getting pregnant. Grandma, yeah. Sorry.
That's fine. Don't worry. So, whilst we wait for Nurse Shomi to get back, if you just joined in, today is a health education live session, and the topic of discussion is ectopic pregnancy. And we have the lovely Nurse Shomi here with us, who is breaking it all down for us. Great.
Yeah, so sorry for the break in transmission.
Don't worry.
So usually, like I said, you might be scared of future pregnancy, and we've talked about the guilt that you might feel, thinking, oh, how could I have prevented this? What could I have done? And also, you might just have that. Why is it me?
Why me?
It's something that is not a common. It's common, but it's still not a common occurrence. If you get what I'm saying, having 1 in 90 women, you can just say, why am I the 1 in 90 women? Why is it me? So women need to be supported when they are going through loss, especially through ectopic pregnancy, because sometimes it's also difficult for you to get pregnant maybe again because you've lost one of your fallopian tubes, so you're now relying on the second one to do the job for you. So you can also seek fertility consultation, going forward to what you want to do about your pregnancy.
Wonderful. So that said, I'm going to ask, how can healthcare professionals and midwives support women during their recovery after an ectopic?
Yeah, to be sensitive. You need to be sensitive and then have empathy. Put yourself in their shoes, because just be human to them. Let them lead. Listen to them. Let them talk. Let them say how they feel. You can also ask questions. You can guide them. You can also refer them to different forums or support groups, or a place where they can just speak about their experience anyway. So you can refer them to it. But basically, be clear in your communication. Speak with kindness. Speak with empathy. Maybe someone is crying. You can't just shout that. So why are you not crying? You should be thankful that you're even alive. You can't be insensitive in those periods of time. And how you treat people will forget your name, people will forget your face, but they will never forget how you made them feel. There's sometimes that we've had different situations. You can't even remember what exactly the person said to you that made you upset, but you would remember vividly that
you were
at
upset.
This period of time I was really upset, and I felt so bad because someone dampened my spirits. So you need to be kind to them, and then accommodate their wishes to an extent. If they need to stay longer in the hospital, let them stay. If they need to go home, let them go home, and then put in follow-up appointments for them.
Wonderful. So your support group, do you support women who have gone through an ectopic pregnancy too?
Usually, it's something we will provide support for, but at the moment, we've not had any cases of ectopic pregnancy. But we've seen people who have experienced stillbirths. So we've provided support with people who have experienced, pregnancy loss, stillbirths, fertility conditions, and that's what we've not seen an ectopic pregnancy, not yet.
That said, I'm sure people may have just joined in and didn't get the opportunity to hear about your support group. Can you give a summary of it to those who just joined in so they can also tap into the benefits? Yeah.
All right. So ANC Winoshomi is an organization, basically telemedicine organization, where we focus on empowering women within their reproductive health, about knowledge about, everything related to pregnancy, trying to conceive, care of your child within your kids, up to the ages of 2. So you have information and you have dedicated midwives to actually support you during this period to answer your questions. So we answer questions very quickly and rapidly. We make referrals for you, like we prompt you. For example, if you come into the group and you say, oh, I think I'm not feeling too well. I think I'm having shoulder tip pain. I think we'll prompt questions and we'll say, okay, have you thought about this? You need to go to the hospital now. So people say, oh, I feel this way, but I can go to the hospital tomorrow. Then, we kind of are triaging them basically because we don't have an emergency number in Nigeria. We triage them to say, no, you need to seek help. And then we also provide reassurance for people, for example, pregnant women who are worried about something. We give advice. We give support, and also there's peer-to-peer support. So you're not only getting support from the midwives and the community managers that we have, you're also getting midwives from your fellow mothers, people who have experienced what you've experienced before. So it's really good. We've been operating for over 5 years, and I would say we've attended to over 500 women. So
God bless you.
So it's the best place for you to be if you plan to be pregnant, if you're pregnant, or if you have children.
You should join in. So I've already mentioned at the start of the live session that the information, I think you said it's a form, right?
Yes, great. It's a Google form.
It's a Google form. Great. So I'm going to leave the link to the form in the description of this, the replay of this live session on my YouTube channel. So my YouTube channel name is Josephine Greatness TV, just as you see on my TikTok profile. That's my TikTok name. Just add TV to it when you are searching on YouTube. Or to make it easier, go onto my TikTok profile. I mean my TikTok bio. My YouTube channel link is there. Click on it and go in there. Right after the live session, the replay will be available, and I'll add the forms to it. If you know any woman, any who, as Neshomi has said, has been pregnant before, is pregnant or is planning to be pregnant, or has a goal, will one day get pregnant, please shout this out to them. There is support and help for them within ANC Show Me, right?
Yes, ANC Witness Show Me. Yeah.
ANC Witness Show Me. So please look out for the Google form in the description section after the live session. So Neshomi, is there anything women can do to reduce their risks of ectopic pregnancy?
So one thing I would say is look after your health. You own your body. Having multiple sexual partners would put you at risk of recurrent sexually transmitted infections. So you can prevent sexually transmitted infection by protecting yourself, by being faithful to your partners, and getting treated as soon as possible. That's what I would say. And also, if you're smoking, it's dangerous to your health. It's not just to causing ectopic pregnancy. It's causing a lot of other things. You understand? So, and also, if you are older and you're trying to get pregnant, just make sure you have, as women, we should have gynecologists that are on our beck and call, like hospitals that we can go to, especially if you are in a country like that is not advanced, that doesn't have advanced emergency care. You should have an hospital that you're using, even if you don't visit them every time. Do regular checkup, to see what your pelvic health is, to be sure you're not even, unwell, treat infections as soon as possible. As soon as you think you're pregnant. So one of the things is, most people in my country, one thing I found out is when people do pregnancy tests, they want to wait till they're 8 weeks or till they're 12 weeks before they actually go to the hospital. So as soon as you get pregnant, make sure you see a doctor, so that you know that even if you're not registering for antenatal yet, just make sure you see a doctor that knows that this person is pregnant. So when they, God forbid, if they need to bring you in an emergency, it's already on your profile that pregnant.
You are pregnant,
and then they can
act accordingly.
Yes.
Wonderful.
So that's one thing you can do for yourself also.
Great. And what advice do you have for women who have gone through an ectopic pregnancy before? What advice? Those who want to conceive again, if they want to conceive again.
Be easy on yourself. Take support. If you need therapy, go for it. If you need, control, if you need everything to be controlled, like in your next pregnancy, if you need to be doing scan every 2 weeks, if you need to just do something that will ease off your anxiety, just request it, and be open and honest with your fears. Be open and honest. Don't be for me like, I'm mad. Don't break down in your house, knowing that you can actually get support from the medical practitioners. So, and I know that people would help you. Like, they're always happy to help. Once you say what your need is, there's always help. There's always provision for help for you. And also, just pray to God, to be honest, and because God is a good God. So just pray to Him, and He's going to help you.
Wonderful. So, medically, how many months do we usually recommend that women wait after an ectopic, treatment before thinking about conceiving again?
Usually, they wouldn't there isn't a set time, but ideally you need to wait at least 3 months because you're
Mm.
healing, you've had a surgery, you're going to be healing. You need to even discuss, contraceptive options, something to put in place, just so that you don't get pregnant and overwhelm your system with pregnancy. So you can wait, up to, it's based on individual conditions. Let you see your doctor, and when you think you are ready, don't just get pregnant. Plan yourself. As soon as maybe you've experienced an ectopic pregnancy, try to put contraceptive in place so that you're more controlled. You're in more control of your body when you want to get pregnant. So, and you can speak to your doctors whenever you're ready. But usually you need to wait at least 3 to 6 months to get your body healed in the first place.
Wonderful. To all those who just joined in, you're most welcome. Those who are following us, thank you so much. I can see Tasha Blessed, you followed, and other people too. Those who are tapping their screens, sharing the live, thank you. We really appreciate that. I've got here with me the lovely Neshomi, who is discussing the topic ectopic pregnancy with us. This is the fourth live session on the Your Midwife series. Neshomi, we've talked about midwives, healthcare professionals supporting women who have gone through this condition. What about families? How can families and loved ones help support women who have experienced ectopic pregnancy?
So one of the first things you're doing is learning about it, understanding what this condition is. So if you don't understand it, if there's any diagnosis, usually I don't say go to Google, but you can always go to Google and then put it into it to just understand, have an overview of what exactly is happening. And compassion goes a long way. You need to be there, you need to support, you need to stand by anyone who is going through ectopic pregnancy, because it's not something easy. You're actually mourning two things. You're mourning the loss of your fallopian tube and also mourning the loss of your baby. So it's not something really easy at all. You need to be kind to them. You need to understand what this condition is so that you're able to support them. Sometimes when we know what it is, but I actually want to hear it from someone else to say, oh, you're not the cause, oh, you're fine, oh, you're this. And also guide this person. Don't allow family pressure. Someone who has just maybe lost a fallopian tube and people are saying, when are you going to get pregnant? When are you going to get pregnant? And then don't let that pressure be a lot on the family. Just guard your family as much as possible to prevent that pressure from affecting the woman. You need to be kind. You need to lead her. You need to affirm her. You need to let her know that childbearing is not even all that it is to life. So support her as much as you can, and show her love, show her kindness. If she needs to, have family members around, don't isolate her and say, oh, you don't need to talk to anyone about it. No, if she needs to talk to family members about it, let her do it. If she doesn't want to talk to anybody about it, let her manage it the way she thinks would work best for her. Because I know in this country, sometimes as soon as you get pregnant, you announce the pregnancy. And then, having announced the pregnancy and having to deal with the loss, sometimes it's a really huge blow on some people. So just take it a step at a time. And also, we would not underestimate the impact of this on your partner, because also them experiencing this life-threatening situation can also traumatize them. So your partners also should be seeking support and getting all the loves and everything together.
Amazing. Thank you very much, Neshomi. I would say that was my last question. And so it's over to you guys. If you have any question, anything bothering you about this topic or any other healthcare, health related question you've got, Neshomi is here and I'm here. So kindly pop it in the comment section, or you can request to join the guest seat. It's 1800 UK time. So we will give about five minutes. Next show me, is that okay if we give extra 5 minutes to see if somebody has got a question they want to ask. So guys, if you joined in late, don't worry. Dia, I can see you've just joined in. Who else has just joined in here? Long life, I see you. Tasha. So if you just joined in, don't worry. Even though you've missed most of the information, the good news is that it is available on my YouTube channel. That's Josephine Greatness TV. When you go onto my TikTok bio, you'll find the link to my YouTube channel on there. Just click on it. It will take you straight into my YouTube channel. When you get there, please, what I say is make sure you are hitting on the subscription button before you benefit from any information you want to find there. So hit on the subscription button, then turn on your notifications so that you don't miss any of my live sessions or videos. And then you'll find the replay of this topic, ectopic pregnancy live session, in the health education playlist. So head on to the playlist, or you can as well check it out in the live sessions column of my YouTube channel, and you'll find it there. If you are going to watch the live replay, don't worry. You may feel that, oh, how can I ask my questions after watching it? Don't worry. You can always pop your questions in the comment section, and we will pick it up and we will answer you. All right. So yeah, that is it. And whilst I'm going on and on with this, please pop your questions in the comment section if you have one, or you can request to join the guest seat. I will also remind you that my debut single, In This Place, the title is In This Place, by myself, Josephine Benson, is available on all digital platforms, and it's available on all social media handles. There are free downloads, okay? So on social media, including TikTok, on YouTube, you can use it as your background music. Miss Ruti, it's great to have you here. Hajia Fidaus, welcome. This user, it's a lot of names, and then Guy, you welcome. You can use it as your background music, your song overs. It's also available on WhatsApp status, guys. So please use it. Support a sister. That said, I've got a music page here on TikTok. It's Josephine Benson Music. You can, follow on there. All my music stuff is on there. I'm on Facebook as well. Find me, Josephine Benson, and let's create community. If you head on to my YouTube channel, if you are anybody healthcare professional who is going through any of the relocation routes, be it US, be it Australia, Finland, Canada, UK, and you need support, you can join my Telegram page and channel. The links are in the description of all my YouTube videos. Join in there, because that's where you are going to get quicker response, because it's not only me. I'm not the only person there. I've got colleagues and friends who are there who can respond to your queries. All right. And I want to say that even though jobs, vacancies have reduced drastically, people are still getting interview offers. Somebody just got an interview offer just this week. So please don't be discouraged. Keep applying for jobs, especially those who are looking at coming over to the UK. All right. God bless you all. I can see there isn't any question. We've got a minute more to allow our lovely Neshomi. Neshomi, God bless you. Please, if you have any final words you want to say, please do so.
Yeah, thank you. Well done, Josephine. You're doing a great job, and I'm so proud of you. So continue to do the great work. Well done. Thank you, everyone, for watching. For people who are going to be watching, so just make sure to join our antenatal group. Basically, if you need any support, we are always here for you.
And guys, Neshomi is a YouTuber. I would say, Neshomi, this is the absolute truth. You are one of the reasons why I started doing what I'm doing now. Neshomi, I would say, is one of the mentors that held my hand through my UK relocation process. She spent her time, she gave voluntarily. I'll never stop mentioning your name when I'm talking about my relocation story. Neshomi has a YouTube channel, guys. So please find her. I'll pop her YouTube channel link in the description of the replay on YouTube. Okay, so please find her. She's wonderful. She'll help you out if you have any queries concerning your relocation to UK. Now, show me, what's your YouTube channel name?
It's Show Me O'Clock.
Show Me O'Clock. Wonderful. I'll pop it in the description section. Please, if you haven't followed her on TikTok, I don't know what you are waiting for. You need to click on the plus sign on her profile. Follow her and go and worry her. She has got you. If you know any woman, please let them signpost them to Nesh Show Me.
Yes,
Let them
bring
go.
them. Love for that to them, yeah.
Okay.
All right.
Wonderful.
Thank
Show
you
Me.
so much.
Thank
It's
you
been a
too.
lovely time. Thank you very,
I
very
really
much.
enjoyed it too. I really enjoyed it. Let me not take too much of your time. Please have a wonderful week, a fruitful one.
All right. Thank you. Bye.
Bye bye. Great. Mary, I see that you've just joined in. Bless you for joining in. Don't worry, the replay of this health education live session is available on my YouTube channel. That's Josephine Greatness TV. Guys, I want to say to you that I'm going to record a video. Sorry, I'm going to record a video about those of you who are on the Canada route. Okay, so if you are on your journey to Canada as an internationally educated nurse, there is a guide for you. Okay, so one of the internationally educated nurses currently practicing in Canada has put together an amazing guide that is going to help you all. So please head on to my TikTok bio. You'll find the link to this guide there. If you are a nurse internationally trained who wants to relocate to Canada, or if you are already on your Canada process, this guide is just like this wonderful colleague of mine, holding your hands throughout your journey. So please head on to my TikTok bio, click on the link, and get your copy. If you have sent me a message in my DM and I haven't yet gotten back to you, please bear with me. I will get back to you. But I'll always recommend that you join my Telegram page and channel because you are going to get quicker response there. There on Telegram, there are pages to support you, especially if you are going through the UK process. There is a CBT page. People are there who are also, preparing towards their CBT. You guys can learn together. You guys can, if you have any question, you can pop it on the page. There are people who have already passed the CBT and they are there to support you. There is an OSCE page as well, an interview page. Yeah, if you secure yourself an interview, there's a page there to support you. Yeah, in fact, recently we've just created a page to support those who are now working in their dream countries, wherever you were in the process. When you get there, you start working. There is a page also there because community is needed, support is needed when you start working. Thank you so much, MSAP, for sharing the live. I see Charity Upon, you've also joined in. All those who just joined in, if I haven't mentioned your name, please forgive me. On YouTube, today we talked about ectopic pregnancy, and we had Neshomi here who, broke it all down to us. She's an experienced midwife. So if you just joined in, no worries. The replay is going to be available. And if you haven't yet subscribed to this channel, you should subscribe to the channel. You don't wait because there is a lot of information here. There are lots of playlists on my YouTube channel for you. There is a relocation playlist, health education, language proficiency. Those who are moving to countries where you need to sit language proficiency tests, there is a playlist there for you. There are videos on IELTS, on OET. And that said, on the Telegram page as well, there is a page for IELTS and OET. So you need to join the Telegram community. All right. And there are playlists. I am a Christian before I'm any other thing. I'm a Christian before I'm a midwife. I'm a Christian before I'm a musician or a singer. So I've got a playlist for gospel messages. I share the gospel of our Lord Jesus Christ. Find that playlist as well. And I've got my music playlist as well. Therefore, you just Benson music playlist on my YouTube channel. The YouTube channel is this channel is blessed, is packed. You can't go away without subscribing. So that said, on YouTube, I'm going to end the live now, and I'll see you in my next video, my next post, or my next live session. It is still Josephine Greatness on Josephine Greatness TV here on YouTube. God bless you. Have a fruitful week. Bye bye. Great.